Well, I'm Professor Ali Otto from Ankara, Turkey. I should like to thank Professor Michele Gulizia for inviting us to this very important meeting in this very nice setting. This morning we'll be having a very important session on the new options for the treatment of atrial fibrillation. As you know, atrial fibrillation is the most frequently seen arrhythmia in the community, and the frequency of atrial fibrillation goes up, increases with increasing age. And atrial fibrillation is very much important for us as physicians because it causes mainly stroke and of course increases mortality in the community. And and also atrial fibrillation is very much important for the quality of life of our patients. So there are several attempts to treat and prevent atrial fibrillation, and regretfully most of them failed to prevent the recurrence of atrial fibrillation. And nowadays we have a new option of electrical treatment, so-called ablation for atrial fibrillation, and there are also a lot of progresses over the last couple of years in terms of ablation or ablative therapy of atrial fibrillation. There are some new options. One of them is balloon-based therapy, which mainly nowadays is with freezing or cryoablation, and it's been shown to be very effective in terms of the prevention of recurrences, and it goes almost at the same level of results with the radiofrequency ablation. And of course there are a lot of novelties on the radiofrequency ablation side as well, and now there are circular ablation catheters to really provide radiofrequency for the PVI, pulmonary vein isolation, and some of those new techniques will also be discussed during this session. And this meeting has been really a cutting-edge meeting in many topics in clinical and interventional medicine.
Okay, my name is Eli Ofsischer. I am from Israel, and I also can talk from beginning about this meeting. I don't remember exactly. It seems to me that about 14 years ago, we discussed with Michele Gulizia about organizing meeting in this area, and probably it was one of the first conversation and discussions that we talked about details, organize this meeting from beginning in Taormina, and now we can see that it's fruitful, very good organizing meeting with a big audience and excellent faculty. Fortunately, I participated in actually in all of these meetings, and in this meeting I will talk about very interesting and special topic that Michele suggests for me. It's a relationship between stroke and RV pacing. As most of us know, that RV pacing today it's a very hot topic because RV pacing may lead to very hard complications like atrial fibrillation that Professor Otto talked about it, and another probably more important complication like heart failure, etc. So actually there is no significant data about relationship between stroke and RV pacing, and to prepare this material, it was not so simple. Anyway, there is no direct relationship between RV pacing and stroke. However, if RV pacing can lead to atrial fibrillation, we can see a relationship between pacing and stroke. So I did prepare my lecture in this direction, and hope it will be interesting. I would like to wish to all participants, to all delegates of this meeting, very fruitful meeting, and as we can see, excellent weather and excellent place. Thank you very much.